For me, I just want to reiterate one of the key concepts of Japanese acupuncture is that we're always looking for abnormal tissue to treat. Um, so, to give you an example from Fukaya's moxibustion, what Fukaya said about a moxibustion point is that in order for it to be a point to treat, it has to have two qualities. The first is that there needs to be induration, and the second that it needs to be reactive when you press on it. So, it's kind of jumpy or painful. So that was his criterion, his two criteria for applying moxa to like small cone moxibustion on a point. Now, with Ontake, we can broaden that definition of reactive quite a lot because we can say cold, moist, rough as deficiency signs, puffy, hollow, and those are all abnormal reactions that we can treat with kind of supplementing methods with Ontake. And then for reactive, like you found there was some um, reactive points in the subcostal and in left stomach 25, 26, 27, those kind of areas, as well as some roughness below the subcostal. So um, those are the things, if you want to do a root treatment from the abdomen, those are the things that you want to focus on is where you find abnormal tissue. Rather than saying, should I do kidney and then should I do stomach and should I do
Uh-huh.
renmai, it's more like, what do you feel? And then treat what you feel. So on a different patient, you might feel a very different kind of abdomen. They might be quite loose in the subcostal, but very, very tight all the way through renmai. So then your
Mm-hmm.
focus is going to be on renmai.
Okay.
Yeah, so
Okay.
so that
It
that's
it
that's that's the point of palpating the abdomen is to pick up those abnormal tissues and then to try and balance them.
okay. I think it's very helpful. What I um finding with my patients, like really some emptiness in some landmine points in lower abdomen, and then some tightness in upper points. Like
Mm,
for example, tightness in REN 12 and absolutely emptiness at
mm,
REN 4, 5, 6. So what I was doing, I would supplement low REM points, and I would like pressing
mm.
or rolling with Ontake upper. This is I kind of tried to do this, but it what you explained me like really helpful because now I have the theoretical concept for this.
Yes.
Okay,
So what you're doing is perfect. So then it's like
okay,
balancing those abnormal tissue findings. And in a sense, that's what we do with Ontake anywhere we treat in the body. So if you're treating the arm, you're still palpating and you're looking for Kyoan Jitsu. You're still looking for abnormal tissue findings. So, oh, look, it's very hollow around lung 9, lung 7, and it's very tight around large intestine 10, 11. So go for the weakness first and supplement the weak areas and then
right,
go back to those tight areas and see if they've changed. If they haven't
okay,
changed, then you can do some pressing. And it's the
okay,
same, like you were asking me about the neck. So, what do we do with the neck with Ontake? So, again, you're looking for those abnormal tissue findings and trying to balance them with your technique.
okay.
Does that help?
Yeah, yeah, it's excellent. It's
Mm.
actually what really clarified me the tactic and strategy as I go through the treatment.
Yeah.
Okay,
So, I
okay,
mean, one of the differences between Ontake and kind of any other treatment that I can think of is that, for example, in TCM, you balance yin and yang in the Zangfu organs. So, spleen qi is weak, or liver yang is excess, or, liver yang, there's a simultaneous yin deficiency and yang excess. So, you're trying to balance those things in the organs. And in Japanese acupuncture, you're trying to balance qi flow in the meridians. Like you're saying, oh, well, I'll treat the liver channel and the mm, kidney channel together. But with Ontake, what you're looking for is excess and deficiency within one channel and then balancing it. So wherever
okay,
wherever you're touching, that's where you're trying to create balance, and that has
Okay.
kind of like holistic knock-on effects.
Okay. What I wrote about working with patients on a head and face. What I noticed, and it was just absolutely incredible experience because patient has such prominent, almost like convulsion of muscle on a face, so like blepharospasm, and then spasm of this muscle, and then spasm of um, neck muscle that she practically couldn't breathe. And yes, it was very pulses on liver and practically everywhere. And the needle didn't do anything. It's like the pulse become better, but the symptoms were still the same. So intuitively, I got a small Ontake and start like working on the area when she has these symptoms. And the minute I touch her, like doing forehead and then go down, she completely relaxed, all symptoms gone,
Wow.
and she fell asleep.
Mm.
So it was like, wow. And she actually referred to this that it was such a pleasant, warm sensation that it knocked her out.
Mm.
So I have a question like, uh, how much I have to pay attention to the area and how much I have to pay attention to some points, especially points on the head.
I mean, my thinking about the head is changing a little bit, kind of the more I study Hirata zones, because one of the explanations or the rationale for ear acupuncture being as effective as it is because it's a cranial nerve. So the signal is going directly from the ear into the brain. It's just that much nerve, right? So it's
Right.
not going along the spine and through lots of synapses and coming to
No,
the brain. It's going straight there.
directly, right.
Yeah, and the same when we're working on the face, then that's also cranial nerve. And the same when we're working
Right.
on the head, that's also cranial nerve. So my feeling is that these regions are actually very important. The face region and the head region in particular are actually very important to do with Ontake because you're signaling directly to the brain. So I don't think it's a question. I mean, of course, the spasms are on the face as well. But the moment you started doing that, you started regulating the autonomic nervous system through
Right.
the cranial nerves. So that's my guess. That's why you got such a
Right.
great reaction,
I
and that's why she fell asleep. Because like, wow,
uh, I I
regulation.
I I agree as a neurologist. I agree with this totally. So